Good morning, everyone. I am going to make this video announcement in hopes of reaching everyone and making sure that everybody gets the same feedback. My feedback to you on the case scenarios is very specific, and so this is an opportunity to make sure that everyone hears the same thing all at once. So I wanted to spend a little bit of time on the case scenarios first, commending you for the good work that you guys are doing. I know at the beginning you were very anxious about the case scenario, but even then the responses were just where they should be for beginning clinicians. And so I wanted to say you're doing great in that regard. However, I noticed that with the extra 15 minutes, many of you took that to mean that you needed to elaborate on that particular question as if it was a full essay. This is not a standalone question. It is a question that's embedded in the assessment and it's a timed assessment, okay? So I'm not looking for 1 and 2 page answers as I have gotten. This should be a succinct and detailed response. You should be able to quickly hone in on what you see as the issues, present those, giving support for your position, indicating what you think a differential or um, giving what you think is the differential or some sort of disorder that mimics the working diagnosis that you have, and then indicating whether or not there are other comorbidities given the context of the scenario. Okay, so I'm not saying don't be detailed, but I do want you to practice being detailed but in a succinct way. Okay. I don't want these really long responses. I want shorter responses that get the work done or get the job done. Okay. Having said that, I do want to reiterate that anything that you share with me about the case needs to come from the details included. For example, if I share with you a case scenario of a young woman who is depressed, and the case scenario gives you all of the symptom presentation, full diagnostic criteria for depression, and there is no mention of anything related to her eating or substance abuse. If you then say the questions that I'm going to ask are about substance abuse and eating disorder, it's going to confuse me. It's going to make me wonder, what did you hear in this description that makes you ask that question? I'm going to feel like you aren't really hearing the client. In other words, this is just a case scenario looking for a working diagnosis. It is not the full intake. So when you are asking your questions need to clarify the working diagnosis. If you don't think full criteria is met, what questions would you ask to ensure that full criteria was met? Or if there's a differential, what questions would you ask to distinguish your working diagnosis from the differential diagnoses that might also explain what is there? Okay, so I hope that that is clear. Again, when you bring in other details that are not in the story, you've overreached and then you over diagnose. Context, when I'm talking about context, it is listen to the entire story, and from that entire story, give me information about what might also be going along for the person, but only from the details included. Don't add in details, don't add backstory, because this is an exercise in seeing if you can listen to what the client is saying and pull the diagnostic criteria from the narrative. Okay? When you're giving your support for whatever is your working diagnosis, please pull that from the narrative. Don't just share what the DSM says is the diagnostic criteria. Share how you came to make that decision about the working diagnosis from what is written. Okay? I'm not leaving things out, hoping to trip you up or to trick you. I'm giving you enough information that you can lean this way or lean that way. You don't have to add to, for example, if all I'm talking about is depression, you don't have to ask about psychosis and substance abuse and eating disorders. That reaches too far for this particular assignment. Okay, I hope that that's clear in what it is you're expected to do. And hopefully it helps you to figure out that you should be able to do this in in the limited amount of time that you've been given. For instance, if we were in class together, this might be, you might take this same quiz, like my folks do in my classes in person, in 30 minutes, right? That means I'm not looking for, again, a separate essay in that case scenario. I hope that this is clear. I hope that you incorporate this information as you complete the next quiz. Failure to incorporate this is really going to result in more point losses because I can't tell that you have the ability to hone in only on what you are reading about, okay? What you are being told by the client. Certainly, if this person was in front of us and they said this and they said that and they said the other, we could be all over the place, right? That's understandable. That's what a full intake would give us. That's not the purpose here, okay? The purpose is based on this limited information, where would I lean in terms of a working diagnosis and how am I reaching that conclusion based on the details included in the scenario and what else might be going on that may lend some understanding and be the focus of treatment. Okay. Finally, I don't need you to give me treatment parameters. That's not what's being asked. Okay. So don't lean into treatment at the end, just working diagnoses, potential differentials or diagnoses that can mimic what you're seeing, and then any comorbid issues, which are things that also may need to be a focus of the treatment, but only from what you've been given in the scenario. I hope that this is helpful. If anybody needs to schedule any office hours, please don't hesitate to reach out so that we can do that. And I will try to set up another and final Zoom meeting for the class, likely next week, and it will likely be on a Monday. I hope this is helpful, and I look forward to continuing to read your work and offer feedback.